coughing or after doing exercise.
All right, thank you, doctor. At what age can asthma be diagnosed? And how do doctors assess asthma in very young children who cannot properly describe what they are feeling?
Uh, Asthma can be um, diagnosed, it can begin at any age. Asthma can begin at any age, but a formal diagnosis is most reliable in children when they are about 5 to 6 years old, because it's at this age that they can follow instruction. A toddler may not be able to, you know, they can show symptoms of asthma, but it is very difficult for doctor to do tests for asthma for children with asthma. So I would say that though asthma can start at any age, at anybody, I mean, they can develop asthma, but it may be difficult to confirm until this child is between the age of 5 and 6 years or older, because it is at that age that they can follow instruction when you are testing, when you are doing the test that confirm or that can diagnose asthma. So for children below the age of 5 to 6 years, you can just have a suspicion that this child has asthma. So when it now comes to what test do you use to diagnose asthma in children, I would say that there is no standard test for children under the age of 5 to 6 years, because there is this breathing test that you call spirometry. It does not work well for children under the age of 5, because they do not follow instruction. You know, they need to blow into the spirometry machine, but most of them under the age of 5 years may not be able to thoroughly follow that instruction. So it may be difficult to make a proper diagnosis of asthma under the age of 5, because some of from the age of 5 to 6 years, then these children can follow instruction. When you tell them to breathe in, they will be able to breathe in. When you tell them, when the time comes to breathe out, they will be able to do that using spirometry. So majorly ways of diagnosis asthma is clinical. So doctor will take medical history and do a thorough examination, asking for question about how long does this cough last, at what time of the day do you have this cough, asking if there is something like wheezing, this whistling sound that comes from inside of the chest. Then family history of allergies and asthma also give away, that this child may have asthma. Then other ways of doing is use of medicine trials. They may need to give a short-acting bronchodilators, which you use for this kind of children. and to see if the breathing improves. For most asthmatic children, child, when you give these bronchodilators, you know, the breathing reduce, the cough reduce, and the child get better. So most of the time you use that, to make diagnosis of asthma in children, or that cannot respond well to spirometry test. For for older children, then you use that can obey instruction from age 6 years and above. Then you use spirometry, a type of breathing test to show how much air this child can blow in and out, and how fast he can do that, you know, to provide a clear proof of blocked airway. There's also what we know as the reversibility test, you know, and this is when this child are given bronchodilator, you know, and they notice to know if this child, you do the test before, then do the test after a bronchodilator has been given. So it helps to, for a child that have asthma, the breathing improves and the test improves after, a dose of bronchodilator. You know, um, the other thing is for older kids, then you can do other series of tests, you know, to ensure, to make diagnosis of asthma.
All right. Thank you, doctor. Let's talk about inhalers because many parents are afraid of them. Inhalers addictive and can using them regularly damage a child's lungs.
Um, Inhaler is just like other medication. Inhaler is a way of, is a method of delivering these drugs for asthmatic. It may be in form of bronchodilator or steroids to directly to where it is needed. We mentioned earlier that asthma is a chronic lung disease, and whatever is happening happens in the airway, the bronchospasm, the mucosa edema, the inflammation, and the hypersecretion, of mucus. Everything occurs in the airway of toward the lungs before, to cause difficulty with breathing. So inhaler is a method, use of inhaler, is the container that you use to deliver this uh, um, medicine into the drug. That's what into the lung. The one you put into your mouth, that is what is called inhaler. An inhaler can contain, for asthmatic patient, it may contain two types of medication. It's either contain a steroids or it contain a bronchodilator, in which the inhaler helps to deliver directly to where it is needed. So there's nothing to be afraid of when it's using inhaler. It's just like a method of delivering drugs to the lung where it is needed, especially. It's just as if you are using eye drops, to deliver medication into your eyes. So that is what inhaler is. There is nothing to be afraid of when using inhaler. It is not addictive. It is just a uh, simple, direct way of applying medication to where it is needed. And in this case, the medication is needed in the lung, and the inhaler helps, for you to easily deliver the medication through into your airway through your mouth. So it is not addictive because the medicine that you are using through the inhaler, they are not addictive. Mostly it's either bronchodilator or steroids or combination of the two that are put into that inhaler for you to use. And it is not addictive. It is simple to use, especially in children, older children that can coordinate their breathing in and breathing out, or or in adults. But for children that is under the age of 5, it may be difficult to use inhaler because these children may not find it difficult to follow instruction of breathing in and out, you know, to coordinate with the normal exchange of air when you are using inhaler. So for smaller children, you may have to use inhaler for if they are asthmatic and they need to use inhaler, you may have to use it with what you call spacer device.
All right, doctor. Can children with well controlled asthma live completely normal lives, attend school, play football, run around, and participate in sports?
Yes, the aim of uh, treatment for asthma, for any asthmatic treatment of child, or the aim of treatment by the doctor for any asthmatic child is to control the asthma, is to control the symptoms. Asthma is a chronic disease. It cannot be cured. It lingers on for a long time. Just like I see someone have an hypertension, it's better not to develop, the symptoms than to cure it. So it can be controlled. Controlling that the frequency of attacks, the frequency at which you have symptoms, the frequency at which you use your inhaler is reduced to minimal. So for a child that is asthma is well controlled, that means he has less symptoms, you know, have less problem with coughing, difficulty with breathing or wheezing, and have less need to use his inhaler, then he can go and do whatever things that uh, he want to do to have a good quality of life. For that side of child that is well controlled, provided is using his medicine, then he can do whatever things that uh, he want to do.
All right, thank you very much, doctor. What are early warning signs that asthma in a child is getting worse?
Uh, some of the one is that when you notice the cough is getting more severe, especially at night, child is having uh, more difficulty breathing, uh, or you also notice that this child, you know, is turning blue. Either the lips is turning blue, the child is not able to talk, you know, make I mean was not able to converse with you. It's an early warning sign that this child, this or the child need to use his or her inhaler more often than necessary. You realize that this is this symptom or this attack is severe, is more severe than normal.
All right, doctor, is there such a thing as a child outgrowing asthma? If symptoms disappear for years, does that mean the asthma is permanently gone?
Um, I mentioned earlier that asthma is a chronic uh, disease, that means it lingers on for years and months. By the time the asthma is well controlled, it shows that the signs and symptoms are no longer there. This child doesn't have attacks. So, for some children, you know, as they get older, you realize that some of these symptoms become less significant, doesn't occur frequently as it used to. And with time, they may not really show more of the symptoms, either because the the triggers, what triggers the attacks is no longer there, or they have developed um, immunity to uh, things that triggers the attack. So that's what made them to have less symptoms. But as soon that they are exposed, you know, to high dose of those things that cause uh, their symptoms, some of them may still show, uh, may still present with acute asthmatic attacks. But we realize that due to one thing or another, as some of them grows, they have less symptoms. As they grow older, they have less symptoms, they have less attack, and that is why uh, they use that word that they outgrow the uh, asthmatic attack.
Finally, doctor, if you could give parents practical rules for helping a child live a healthy, active life and avoid severe attack, what would that rule be?
I would say some of the one of the causes, of asthma in our environment is the indoor and the outdoor environmental pollutants. For a child that is having asthma, please let us reduce indoor pollutants as much to minimal level as much as we can control. You know, exposing this child to indoor pollutants, can triggers their asthma symptoms. Uh, for us that use wood, you know, firewood to cook indoors, uh, it's one of the house. Dust, um, secondhand smoking, exposing your child to cigarette smoke, kerosene stoves, firewood, burning of fuel. Inside the house and some of the triggers. The house outdoor pollution, as much as possible, uh, release of industrial waste, um, triggers, you know, asthma is most, as an environmental, outdoors environmental pollutant. Traffic exhaustion, release of exhaust, from traffic congestion, burning of woods, all these ones also increase outdoors environmental pollutant that triggers asthma in some of these children that have preponderance for acute asthmatic attack. So as much as possible, reduction of both indoors and outdoors pollutants have a long way in reducing the frequency of attacks for all these children that have high risk, for developing asthma. So as much as possible, let us avoid this as much as it lies in our control.
Okay, thank you so much, Dr. today and helping us understand asthma in children beyond the wheezing. To every parent listening, breathing difficulties in a child should never be dismissed simply because the child isn't wheezing. Pay attention to patterns, persistent or nighttime cough, breathlessness, chest tightness, difficulty keeping up with other children during play, or repeated episodes of breathing difficulty. And if your child is struggling significantly to breathe, don't wait for the symptoms to pass on their own. Seek urgent medical care. This has been Radio Doctor on Women Radio 91.7. I'm Hassan Imatula. Join us next Monday for another conversation on children's health. To have a healthy day. Good morning.
Thank you for having me.